How many people do you know that smoke cigarettes? Probably many, like your parents or other family members, and it can affect your life as well. Hi, my name is Reem, and today I'm going to be conducting an informative speech about nicotine addiction. Nicotine addiction is the second leading cause of death worldwide. According to Medscape, an informational website, there are numerous different symptoms of nicotine addiction. The physical effects of nicotine addiction include accelerated heart rate, increased blood pressure, and weight loss. The time from having your first cigarette to the total of 2 cigarettes per day are the 2 strongest predictors of nicotine addiction. In addition to its physical effects, nicotine exerts a strong level of behavioral influence. Nicotine may also enhance an individual's alertness, although tobacco abuse and dependence may simulate frantic, almost panic-like pictures. After learning the different symptoms of nicotine addiction, we can proceed to the diagnosis and symptoms of nicotine addiction. Nicotine addiction is also referred to as a tobacco use disorder. There are many different ways to tell if someone is addicted or might lead to becoming addicted to nicotine. Some people may start to develop some sort of tolerance, as defined by either the need for increased amounts of tobacco use or to achieve a desired effect or emotion. Also, a dismissed effect would continue use of the same amount. Diagnosis also state that some may continue to use tobacco to relieve or avoid withdrawal symptoms that may occur if the person were to stop. Another sign of nicotine addiction is the use being continued despite knowledge of the present or reoccurring physical problem that nicotine has caused. Now let me explain the different ways to help manage nicotine addiction. One of the most popular processes used to manage nicotine addiction is called nicotine replacement therapy, stated by Medscape.com. Nicotine replacement therapy works by making it a lot easier to stay away from tobacco and by pretty much replacing the nicotine previously obtained from tobacco. The overall nicotine replacement quit therapy is a 50 to 70% rate. Using additional nicotine support can also provide an increase. Different types of nicotine replacement therapy products that are currently selling on the market are transdermal nicotine patches, which are skin patches used to help many people stop smoking cigarettes. These patches provide a source of nicotine that reduces the withdrawal symptoms a person might experience after stop smoking. Nicotine nasal spray is a spray that's classified in the medications called smoking cessation aids. They work by providing nicotine to your body to decrease the withdrawal symptoms experienced when smoking is stopped and to reduce the urge to smoke. Nicotine gum is used by the mouth orally and is also chewed but should not be swallowed. People must use nicotine gum as directed, making sure it's not used any more or less than they should be using. Nicotine lozenges are used orally as well and dissolve in the mouth and should be used according to directions on the package. Most people use them 15 minutes after eating or drinking. Sublingual nicotine tablets have many different brands. The most common dose of these are 150 milligram tablets that can be used once to twice per day. Nicotine inhalers are inhalers that look like plastic cigarette holders. It requires a prescription in the United States to have them. The inhaler is used by inserting nicotine cartridges into an inhaler and puffing for about 20 minutes. Most are told to use this up to 16 times a day. Nicotine addiction is also called tobacco dependence. This addiction is when someone is addicted to tobacco products caused by the drug nicotine. Looking back at what we've gone over, different symptoms, signs, and ways to manage nicotine addiction, which are very important in human health. Regardless of how long you've smoked, stopping smoking can help improve your health. Cigarette smoking kills more than 440,000 Americans each year, with an estimate of 4,900 of these deaths from exposure to secondhand smoke. Thank you so much for listening.